Well, welcome everybody to this month's edition of It's a Brain Thing. I'm honored again this month, for the second month in a row, to welcome a friend of mine and a colleague, Dr. Bojrab. He and I went to Indiana University psychiatry residency together, so we pestered each other for 4 years or so. Well, 3 years. You're ahead of me. So.
Exactly.
But I've asked him to come and speak to us tonight about sleep disorders and all different types of things. And of course, at the end, there'll be time for questions, so you guys can ask anything you'd like. So I'll turn it over to Chris.
Thank you very much. It's a pleasure to be here with you all this evening. Again, I'm Chris Bojrab. I'm a psychiatrist in general practice in Indianapolis, and I'll start out with a disclaimer that I am not a sleep specialist. I have no formal training in sleep, but sleep is something I've really been interested in clinically because I've become increasingly convinced that regardless of how you take care of patients, or if you're a patient with a variety of different types of medical conditions, sleep really impacts nearly everything that we treat. And sort of selfishly, I'm interested in treating sleep disorders because when I treat a person's sleep disorders, if I get them sleeping better, more effectively, more efficiently, everything else I'm trying to treat becomes easier to fix. So I thought we would, I don't have any formal notes or slides or anything. I thought we just would sort of talk about sort of the state of affairs with where we're at now and our understanding of the importance of sleep and the treatment of sleep disorders, some of the major different sleep disorders that we see, and sort of what our approach is for the treatment of things like insomnia now, compared to what it was just 5 or 10 years ago, because it's really changed a fair amount. Sleep disorders are pretty common. Probably insomnia is the most common of the sleep disorders, and insomnia really can come in a lot of different flavors. This is not simply about trouble falling asleep. When you talk about insomnia, that's usually the first thing that people think about is I'm having trouble falling asleep. But if you look at all of the types of sleep disorders that people have, falling asleep is only about a third to a quarter of the problem. People also have difficulty maintaining sleep. People have difficulty with non-restorative sleep. People have difficulty waking up too early in the morning and then not being able to fall back to sleep. And in terms of the scope of the problem, probably somewhere around 30 million Americans will suffer from insomnia in the course of a given year. Now, for most of those patients, it's what we refer to as a transient insomnia, meaning I'm having trouble falling asleep, staying asleep, or early morning awakening. That happens once in a while. When we get into a pattern of what we call chronic insomnia, we're talking about patients who are having typically 2, 3, 4 nights a week where they're having more significant, more substantial problems falling asleep, staying asleep, or having a good night's sleep that restores them and allows them to function optimally the next day. Now, interestingly, as common as this problem is, people are really unlikely to go in and complain to their doctors about it. It's almost like people just sort of assume that, given our busy lifestyle, we're supposed to feel tired. We're supposed to not sleep well. So they've done these large-scale telephone surveys, like the Gallup organization that does all the telephone surveys, where they've called up people across the country and randomly asked them about the quality of their sleep. And they identify these folks that meet criteria for some clinically relevant insomnia problem. And they ask them, how often have you specifically made an appointment to go in and talk to your doctor about this problem? 5% of them. Almost 70% of them have never even mentioned it while they were in an office for something else. So if they're in for their annual checkup and the doc asks, how are things going? Even if they're having insomnia symptoms, almost 70% of patients won't mention it. People just sort of assume that's what's supposed to be the state of affairs. So sleep's really important for a number of reasons, only some of which we understand. We know that sleep serves sort of the general restorative function. People that don't sleep obviously have trouble feeling fatigued the next day, but it also impairs concentration. It impairs your ability to focus. It impairs your ability to remember things. It impairs your ability to learn new information. It also contributes significantly to other medical problems. There's mounting evidence that chronic pain disorders are much worse in patients who aren't sleeping well. Depression can be caused by lack of sleep. Anxiety problems can be caused by lack of sleep. Not sleeping well over the course of time can dramatically increase the risk of somebody becoming addicted to alcohol or drugs. People that don't sleep well are also at markedly increased risks for accidents, especially motor vehicle accidents. There was a study that was done a few years ago out at Harvard Medical School where they looked at the house staff. They looked at the interns and residents that were working there for Harvard Medical School. And they had them track over the course of 4 years car accidents. How many times were they in a car accident? And people were 4.5 times more likely to be in a car accident the night that they were post-call, the night that they hadn't slept well. So it really has a dramatic effect, and they're starting to look at this from a safety issue concern for the general public. If you look at hospital errors that are made, dispensing errors in pharmacies, giving the wrong drug in a hospital, there's a marked spike on the likelihood of those things happening on second or third shift compared to daylight shifts. So we don't function great when we're being asked to fight our circadian rhythms and when we're asked to be awake in the middle of the night, nor do we function very well if we're not getting a good night's sleep. If you look at what the normal sort of pattern of sleep is, in terms of how long should it take me to fall asleep, most of the time, a healthy person with a good sleep pattern should fall asleep probably within 10 minutes of going to bed, 10, 15 minutes. People that fall asleep terribly quickly after getting into bed, that can be a sign that they're having what we refer to as excessive sleepiness. They're so tired that they fall asleep faster than expected when your head hits the pillow. People should also sleep soundly through the night. Now, if somebody wakes up once during the middle of the night and they're awake for 5 or 10 minutes and they say, hey, I saw one of those commercials on TV for those sleep pills. Do I need me one of those sleep pills? No. That's considered within the normal realm of normal, healthy sleep. So when we're talking about patients with insomnia, we're really talking about people that have more severe disturbances. And a lot of people with insomnia don't just miss out on 15 or 20 minutes of sleep. They're missing out on hours of sleep during the night. Most patients really do function best sleeping 7 or 8 hours a night. There have been various studies looking at this. There have been some studies looking at how much do people really sleep. Part of it falls out based on gender and race and where you live in the country. For example, there was a neat study that was done up in Chicago where they surveyed a bunch of residents of Chicago, and they actually had them wear these little devices that tracked how much they were sleeping and basically paid attention to whether or not they were moving around, what their breathing pattern was like. And it asked people to self-rate their sleep. First of all, we're terrible at rating the quality and quantity of our sleep. I know this from personal experience. I was diagnosed with sleep apnea a number of years ago. My wife's like, you need to go in for a sleep study. She's a nurse. She said, she goes, you're snoring like a lumberjack, you're having prolonged apneic episodes, meaning when you stop breathing in the middle of the night, you sort of start gasping, and I think you've died. You need to go in and get a sleep study. I said, okay, I can believe it. I got the habitus for it. I got the body style. If you're a big guy. Little trivia, if you have a neck size greater than 17, there's probably about an 80% chance you've got sleep apnea. So I said, hey, I fully believe I could have sleep apnea, but I was asymptomatic. Because what do you normally think of with sleep apnea? People being tired, people falling asleep, people need to sleep more than usual. That wasn't me. I got tons of energy. I'm sort of a short sleeper. I sleep most of the time. This is the do as I say, not as I do. I sleep on average probably 5 or 6 hours a night. And there's about 10% of the population that really does get by fine on 4, 5, 6 hours of sleep each night. But the majority of folks function best on 7 or 8. And similarly, about 10% of people need maybe 9 or 10 hours of sleep. So I said, gosh, I'm sure I snore. I could believe I have sleep apnea. But I didn't feel symptomatic from it. Felt fine, didn't feel tired. So I went in for a sleep study. And they said, you had nearly 80 respiratory problems per hour during the course of the night. Now, if you have what's called an apnea-hypopnea index, which means how many times do you sort of stop breathing or almost stop breathing, if that's more than 5 or 10 per minute, that's considered, 5 or 10 per hour, that's considered unusual. That's considered atypical and not normal. Mine was up there like, 60, 70, 80. So then the test they do the next morning, which is called the MSLT, the multiple sleep latency test. Anybody here have a sleep study? Okay, a couple of you. Remember, did you guys do the thing the next day where they asked you to take naps during the day?
Didn't have to go that far.
Didn't have to go that far? Well, that's one of the ways. The sleep studies are broken down into 2 things. Sleep studies are also called polysomnograms. Poly meaning many, somna meaning sleep, and gram a measurement. So they take many different measurements of you while you're sleeping. They put EEG leads, they measure brainwave activity. They put on a heart monitor, measure your pulse. They measure your breathing. They measure how much you're moving around. They measure oxygen saturation in your blood to see how well your lungs are oxygenating your blood when you're sleeping.